The most common thing that I see in my practice is rotator cuff tears, and rotator cuff tears have a spectrum. There are very small partial thickness tears to full thickness tears to what can become massive tears that can be almost impossible or very difficult to repair, and not just repair, but to be able to get them to heal. And so you may have been told by another surgeon or another physician that you have a really large tear, and this is a complicated problem that we've been trying to figure out ways to fix, over the last 20, 30 years in orthopedics. And we've had a lot of different surgeries to try to address this problem. And typically in orthopedics, when we have a ton of different options to fix something, it means that one thing hasn't kind of borne out as being the best way. And one thing that you may have been suggested to, if you have a massive rotator cuff tear or you've already had a repair and it's failed, is a reverse shoulder. Now, I think a reverse shoulder is a good option in that setting, but I think that there are some other newer options that we have now that we're actually seeing have worked quite well, that don't require you to have your shoulder replaced. And in particular, one of those operations is something called a superior capsule reconstruction. And the superior capsule reconstruction was actually developed in Japan by a surgeon named Mahata. And the reason why it was developed there is because they did not have the reverse shoulder approved for almost 10 years past the rest of the world. So, necessity is the mother of innovation, essentially. And so they needed a way to fix these patients or help these people that have massive tears, and they couldn't do a reverse shoulder. So what he developed was a very, very elegant procedure where he took an allograft of tissue, or an allograft piece of tissue, and anchored it to the glenoid and anchored it to the humerus. And what that does is it prevents the humerus from going superiorly, which is what happens when you lose the rotator cuff on the top of the shoulder. And so in the past, we had different tendon transfers, the reverse shoulder, but now in 2017 we have this option here, and what we're seeing, it's a new surgery in the United States. It's only been being done for maybe 2-3 years tops. But what we're seeing is there's a lot of these patients who have these massive tears that we couldn't fix in the past, that this is giving us an option to be able to give you improved range of motion and most importantly, pain relief in your shoulder if you have a rotator cuff tear that cannot be fixed. And so it's done arthroscopically, it's done as an outpatient, and the rehab is very similar to what it would be for a rotator cuff repair. So it essentially gives us another tool in our toolbox to treat people with very large rotator cuff tears. And the early results have been very promising with this procedure. So there aren't a huge number of surgeons doing it right now, but we're starting to see there's a great result. And if you have been told that you have a massive tear in your shoulder that cannot be fixed, make sure that you explore this option of superior capsule reconstruction, because it is proving to be a very, very viable option in people with large cuff tears.